My name is Puneetpal Bains. I'm one of the endocrinologists here at Genesis HealthCare system. After undergrad, I did my medical school at Saba University School of Medicine, and following that, I completed a 3-year internal medicine residency at the Jewish Hospital in Cincinnati, Ohio. And following that, I was a hospitalist for a few years. And my hospitalist stint included being a nocturnist, where I specialized only at nights. And also, I was one of the staff physicians for the main campus at Ohio State, Wexner Medical Center. And after a few years of doing that, I did a fellowship in endocrinology at the State University of New York in Syracuse. So after my endocrinology fellowship, I've basically been practicing endocrinology in the southeastern Ohio since 2016. And I started with Genesis Healthcare System in April 2022. Endocrinology is a very intriguing field. So I kind of give an analogy of being a detective. So when a person has an endocrine disorder, you have to kind of ask a lot of questions. You have to look at a lot of details, look at a lot of data. You have to go digging sometimes, and that digging is what really I find fascinating. So it's an intellectual field, and it involves a very good relationship with the patients and the doctors to get to the bottom of that. So it's a collaborative team effort, and it's just so fascinating. Endocrinology is a specialty. It's basically a branch of medicine that deals with the hormones and dysfunction of those hormones. So basically, as an endocrinologist, we look to alleviate those dysfunctions by giving medications. We deal with common disorders such as diabetes, osteoporosis, thyroid disease, parathyroid issues, pituitary issues, and such on. In this area, we do have pretty much a lot of patients with diabetes, and it's very important to catch it early if you can, so even at pre-diabetes stages, so you can prevent the progression of diabetes. And two, if somebody has diabetes, it poses a lot of health complications. So uncontrolled diabetes can play a role with heart attacks, strokes, even retina damage or blindness, and even kidney damage, and so on and so on. So the moment you know you have diabetes, it's very important to start or to seek the help from a professional right away, because we have a lot of studies that do show good early control will even prevent the potential of damage or complications down the line, even if your down the line control worsens. So it's very important that we work on this together. So my favorite part of being a doctor has always been actually like the patient interactions and seeing the patients and trying to help somebody get better. I think that's why I got into medicine, and that's why I'm still in medicine and practicing today.